Breast milk oversupply is a common concern for many nursing moms. A plentiful supply of milk is generally regarded as a good thing. But too much can cause problems for the mother and the child. It's the Mom Hack YouTube channel. Subscribe and let's get started. When a mother produces more milk than her infant requires, this is known as breast milk oversupply. Oversupply of breast milk that continues after the first 6 weeks or so can have many causes. Typical reasons of overstock include the following. 1. Overstimulation. Overstimulation of the breasts, whether from excessive pumping, can signal the body to produce more milk than necessary. 2. Overuse of pumping. Regular pumping in addition to breastfeeding can contribute to oversupply. While pumping can be beneficial, moderation is key to avoid overstimulation. 3. You are feeding your baby on a set schedule rather than according to need. 4. Your baby wants to suck for comfort. 5. Hormonal factors, too much prolactin in your body. Here are some common symptoms of excess breast milk. Engorgement. One of the primary symptoms is breast engorgement, where the breasts become overly full, firm, and sometimes painful. This can make it challenging for the baby to latch on properly. Forceful letdown. A forceful letdown, also known as a fast milk flow, can cause the baby to struggle while feeding. The milk may come out with such force that the baby may cough, sputter, or pull away from the breast. Frequent spit up. Babies may experience more frequent spit up or vomiting due to the abundance of milk. The fast flow can overwhelm the baby's ability to swallow and digest. Fussy or gassy baby. An oversupply of milk can lead to a fussy or gassy baby. The excess milk can cause discomfort, and the baby may appear unsettled or colicky. Short nursing sessions. Babies may have shorter nursing sessions because they quickly get a substantial amount of milk during the initial letdown, leading to less time spent at the breast. Weight gain issues. Paradoxically, while it might seem counterintuitive, oversupply can sometimes be associated with weight gain issues in babies. The excess formilk may be high in lactose and low in fat, affecting the baby's overall nutrition. Milk spraying. Experiencing a forceful letdown may result in milk spraying from the breast when the baby unlatches. This can be messy and may contribute to the baby's difficulty in maintaining a good latch. Overactive suck reflex. Babies might develop an overactive suck reflex in response to the fast flow of milk, causing them to suck harder or more frequently. Leaking between feedings. Mothers may find that their breasts leak milk between feedings, even when not actively breastfeeding or pumping. Difficulty with sleep. The baby may have difficulty falling asleep or staying asleep due to discomfort. Also, as a result, you can get blocked milk ducts, mastitis, breast abscesses. Tips for reducing breast milk oversupply. 1. Limit pumping sessions. If you're using a breast pump, limit pumping sessions and focus on pumping only when necessary. Gradually reduce the time spent pumping to signal your body to produce less milk. 2. Block feeding. At each feeding, only use one breast to feed your baby. Switch to your other breast for your next feeding. Keep doing this for a few days. To ease pressure or discomfort, you may need to manually express a small amount from the underused breast. Don't empty that breast because your milk production will decrease due to the leftover milk in the underutilized breast. Block feeding makes sure that there is always milk left over in one breast. This will cause your breasts to produce less milk, which should eventually eliminate the excess that is produced. It takes different times for different people. Additionally, block feeding will lessen the quantity of thinner formilk your child consumes. Your baby's stools will become thicker as they consume more of the rich hind milk. This indicates that you are moving forward. 3. Manage engorgement. If engorgement occurs, use cold compresses or cabbage leaves to relieve discomfort. Avoid excessive pumping during engorgement. 4. Adjust feeding positions. Experiment with different breastfeeding positions to control the flow of milk. Consider reclining or side-lying positions to allow gravity to slow down the milk flow. 5. Seek professional support. If oversupply persists, consult with a lactation consultant for personalized advice and guidance. If you find yourself grappling with breast milk oversupply, remember that seeking help and experimenting with different strategies can lead to a more comfortable and enjoyable breastfeeding experience.